Hello, everyone. Welcome to another review class for our lab practitioners. Today we shall be focusing on, we will continue with a review on red dry tongues with a crack in the center. So expect a lot of pictures for the tongue. So we have here an example of a 42-year-old female. So as you can see, the tongue looks Uh, it doesn't look pale to me. It's a little bit dark, no, dark red, no. Okay. Okay, so symptoms of the patient, tendency to catch cold. So we have a very she has a very weak immune system, severe exhaustion, and probably this explains why we see the depression on the posterior, no? Kasi if you have this like this one, parang vena siya, so that means the the kidney essence is very poor, very weak. Desire for sweet foods, that's craving for somebody who has a disconnect between the kidneys and the heart. Weight gain, loose stools. So this is very spleen. Background to disease, overworked, and caffeine abuse. Okay, so let's look at the description of the tongue. As you can see, yeah, di pala siya red, slightly pale. Okay, slightly pale, and the edges are swollen. Okay, so and then the center is slightly reddish. Yeah, this is what we were talking about. The tongue body is pale. However, if you look at the center of the tongue, it's red. No? Kasi our focus of discussion will be the crack center, uh, crack, crack in the center. So, yun. So, the slightly pale swollen edges would tell us that there is spleen chi deficiency, which is manifested as dampness. Kaya medyo malaki siya, no? And then the center, if you look at it closely, is slightly reddish without root. So that means may nawaksi na coating. Okay, so this is telling us that the stomach is having heat and dryness. Okay, the coating is normal with thin white coating, and the depression of the root, which we were discussing earlier, the patient is so pagod, so overworked. This one. This is Qing deficiency or essence deficiency. Okay. We have another example, this time from a 26-year-old male. Symptoms. So this patient is much younger. Symptoms, heartburn, regurg, and then there's stomach pain every time na-stress siya. And every time he takes dairy products, nagda-diarrhea. So baka may lactose intolerance. Background to disease, stress due to examinations. Okay, I've seen people who are like that pag nag-exam na stress. Excessive intake of dairy products. So as you can see, the center of the tongue is it's so obvious that it's walang coating, no? And it's red. Yeah. So first, let's look at the color of the tongue. It's pale red, so that means the color is normal, but slightly swollen. So if there is swelling, we look at spleen chi deficiency. Okay, and so the center is red, slightly peeled. So that means there is stomach heat or onset of stomach heat. Red is heat, no? Yellow coating with red points at the root. Do you see the coating here? Now, the posterior third of the tongue actually would be all about so there are four possibilities: the kidney, the bladder, the small and large intestine. However, if you remember um the symptoms, so we have to correlate it. There are no urinary symptoms. So this time we have to look at the LI or the SILI. Okay, so there is dump heat. Kaya yellow and coating with red points. As you can see, the papillae are very prominent, no? Yun. Okay? So dump the coating and then the color with the red points speak a lot about heat. Okay. Next, we have a 44-year-old male, okay, complaining of heartburn, stomach pain, hot feeling in the stomach, and fatigue, inability to fall asleep. Fatigue na siya, but he could hardly sleep. He could not get some sleep. Okay, Western diagnosis, reflux, esophagitis, background, irregular eating habits, and strong demands at work. So pressure. So let's describe the tongue. So as you can see, so it's not red, it's pale red, and the tongue body is slightly thin. And if you look at the edges, they are pale, no? Okay. And there's a vertical crack. If you look at the tongue body, this speaks a lot about spleen deficiency with an involvement of the liver. Kasi the sides are very pale or slightly pale. So that's very liver blood deficiency. Okay. So this usually happens if there is an issue with the spleen, the liver is something to do with it. Okay. Kaya at first you need to look at the color of the tongue body and then compare the sides. Okay. Then we have the vertical crack with small horizontal cracks branching off and without coating. So this is very stomachian deficiency. Okay. There's no coating. Slightly reddish center of the tongue. So there is already stomach heat. Next, we have a 38-year-old female coming in with bleeding gums, dry stools, pain under the ribs. So Western diagnosis is periodontitis. Okay. Background, excessive consumption of spicy foods, caffeine, and black tea. So the tongue is pale red and the shape is pointed. Okay, if you see a tongue that's slightly pointed, it's a tip, think of heat heart. A heart in the heart heat, okay? Yan, nagpo-point yung kanya, parang pointed yung kanyang ano, no? And if you look at the center, it's dry and red with cracks. So there is stomach heat and there is already an onset of stomachian deficiency. And the sides are slightly contracted. Okay. Para siyang lumiit, nagko-constrain siya. That's liver chi constraint. That means chi cannot flow well. Okay. Another one, if we have a younger patient, 22-year-old, okay, complaining of severe itching of the skin, damp red skin lesions, no appetite, feeling of fullness after eating, soft, smelly stools. By the way, your stool should not be smelly. Pag smelly yan, there is heat, no? Damp heat. Night sweat. Yeah, kailangan hindi siya mabaho. Inner restlessness, depressive moods. So Western diagnosis is atopic eczema. Okay? Yun lang. Background, family history. So it runs in the family. Alcohol and caffeine abuse and long-standing emotional problems. I tell you, if you have eczema, you should always try to manage your emotions. Usually nagpo-flare up yan. So if you describe the tongue, okay, as you can see, it looks normal to me, pale red, and the sides are slightly swollen, diba? So what does this tell us? There is spleen deficiency, spleen chi deficiency with dampness, and there are small cracks at the center of the tongue, dry center without coating. So if that is the case, nawawala na yung coating, you have stomachian deficiency coming in. And then if you look at the posterior third, diba, doesn't it look very yellow to you? And the coating is thin, so there is slight retention of damp heat in the lower burner. Next. Okay. So, hindi ba kayo nalalula sa dami ng tongue? Okay. 37-year-old male. So, since our topic is the center of the tongue, the crux, so focus kayo dito. But again, first you need to look at the overall tongue body, no? Symptoms niya, constant headache, migraines, inner restlessness, occasional stomach pains. Background,
Bobby.
He sustained skull fracture 2 years ago, so there is trauma. Alcohol abuse in the past, excessive spicy foods, emotional problems, smelly loose stools. Okay, so here you could see that the tongue is red, wide, and thin. Okay, it's malapad, no?
White head.
So it's red, so that means there is dryness. We call it injury to fluids due to heat. And then the center is peeled, red, and cracked. So there is stomach deficiency with stomach heat. Now, if you look at the edges, it's curled up and slightly swollen. So there is heat in the liver. Okay, liver qi constraint with heat in the liver. And then if you look at the tip, it's curling down. No, so down is deficiency. Okay, and if you look at closely, it's a little bit red. It's a lead. So there is empty heat, no, resulting from heart deficiency. Okay, so if it goes up, that's excess. Okay, so ito you can have heat either pababa or pataas. So since this is pababa, the heat is coming from a deficiency condition, heat deficiency, a heart deficiency rather, heart yin deficiency. And then yellow, slightly thick coating with red points at the root. So this is very heat and damp, accumulation of damp heat in the large intestine. Okay, meron pa. 54-year-old female naman, loss of hearing in the left ear, tinnitus and earache, panic attacks, inner restlessness, nervousness, dizziness in the morning, headaches, insomnia, occasional night sweats. Western diagnosis, acute loss of hearing. Biglang nawala yung pandinig. Okay, so background, you should always elicit the history of pressure at work, excessive demands at work, and emotional problems. So the description of the tongue, as you can see here, it's pale, red, and swollen. So that means there is spleen chi deficiency with accumulation of dampness. On the left side, hindi nyo napansin, medyo ano, if hindi siya pantay, no? Like in this case, you see the coating is sloughed off dito sa right side, no? And ito, so that's liver and gallbladder talaga, okay? Thick, greasy coating on the left side. So thick, greasy, that's damp heat. Coating without root, okay? That's stomach yin deficiency. Deep crack in the center with yellow, greasy coating, that's phlegm fire, no? As you can see, the texture, the quality of the tongue is rough. So phlegm na phlegm po yan. And in this case, since yung kulay ng coating niya is yellow, that's phlegm heat. This is the last one. We have a slightly older patient, 66-year-old, suffering from severe constipation, heartburn, stomach pains, extreme physical weakness, night sweats, and pain in the bones. Diagnosis, Western, prostate cancer with bone metastasis. Okay? So tinan yung itsura ng isang
Wow.
may cancer, no? Okay. It's usually red, as you can see, kasi may nangyayaring gera. The background is overwork and emotional problems. Okay. Actually, I know someone who just, okay. The tongue, red, firm tongue shape. So firm siya, medyo matigas siya. And then coating without root at the center and also at the root. Root is posterior. That's stomach and kidney yin deficiency. Yellow old coating, damp heat accumulation in the large intestine. Now let's go to assessment. Sir Jobel, you are so excited. Would you like to answer? Okay.
Yes, Doc. Good afternoon, everyone.
Okay. If you see a short tongue, what diagnosis comes into mind right away?
Fail with cold, red, and pale yin deficiency, short tongue.
Okay, depende, no? If it's short, This is the opposite of long tongue.
Long.
Okay.
Wala pang favorite.
Wet or cold, red. Pag red siya, it's usually
Red.
filled. Yin deficiency, walang coating. Okay? Okay, if you see a mark, a tongue that is teeth marks.
Spleen deficiency daw.
Spleen
Pag
chi
may tooth mark.
deficiency.
O spleen chi deficiency. Oh. Spleen chi deficiency.
Okay, yung tongue niya nagki-quiver. You know, quivering? Parang, yeah. What does it mean? Quivering?
Spleen chi deficiency.
Okay.
Spleen deficiency po. Spleen chi deficiency dun.
Okay, spleen chi deficiency. Deep red tongue, tapos may exogenous febrile disease. So what do you think
Okay.
is the pathogen?
Invasion of yin and blood system by pathogenic heat.
Can you give us an example of pathogenic heat, no? Katulad ng summer heat, no?
Summer heat.
So, naubos yung yin and blood niya. Kaya naging deep red tongue, na-injure.
Fluid.
Okay, if you have a deep red tongue and an endogenous, galing sa loob.
Endogenous. That is yin deficiency with fire.
Okay, with fire. Empty heat. Purple tongue, pale purplish, tapos moist. This is very significant. You need to know if it's moist or dry.
Purplish and moist. Cold stasis of blood.
Yes, so there is blood
Sobrang
stagnation.
malamig. Uh,
Blood stasis due to cold. Purple
Blood
tongue,
stasis.
deep blue purplish, also dry and lusterless.
That is heat.
Okay, there's heat. Center of the
Okay.
tongue body is what area of the tongue?
Spleen area of the tongue. Spleen.
Spleen and stomach. Sides.
Liver area.
Okay. And finally, the back of the tongue body.
Lower jaw, kidney.
Yeah, usually the kidney, pero pwede ring large, small intestine, and also the
Lower jaw.
bladder. Okay, maraming salamat po. Thank you so much. We hope to see you again soon.